coordinator for DeSales University Division of Nursing. And I'm also the Mu Omicron Nursing Honor Society president. With me this morning is Karen Peterson, a retired professor of DeSales University for mental health, who is also a board-certified clinical nurse specialist and nurse practitioner in mental health. Kristen Eichholz, Executive Director of Career Development. Mark Kenny, Director of Master's Program in Clinical and Counseling Psychology of Chestnut Hill College at the Lehigh Valley campus at DeSales University. Jim Presto, AFSP Eastern Pennsylvania Chapter Board Co-Chair. Aaron Feckenthal, Master's in Education Prepared Counselor at our Health and Wellness Center at DeSales. And Mary Pollard, a Bachelor's Nurse, Clinical Coordinator, Division of Nursing. Just as a quick reminder before we do get started, for all of our virtual attendees, if you can please keep your microphones muted, and if you have any questions along the presentation, to utilize the chat box for us to address as the program continues. And to get us started, I'd like to welcome Jim Presto, the American Foundation of Suicide Prevention Co-Chair.
Thank you. I first appreciate the opportunity to be here today. And working with the great team from DeSales. Just a little bit about the American Foundation for Suicide Prevention. It's the largest not-for-profit organization dedicated to suicide prevention through education, advocacy, and research. And we also, one of our fourth pillar is actually the support of survivors of suicide loss. So been around since 1987, and it was a group of people that had lost loved ones to suicide, and they got together with a group of scientists and trying to figure out ways to not lose so many people to suicide. And it's kind of evolved. We have chapters in all 50 states and volunteers in all 50 states, and it's a very active program. So that's a little bit about who we are. What I wanted to do was spend some time just talking about suicide in general. And the very first bullet on the slide says that it's a health problem. And what a lot of people don't really understand, there's a lot of stigma around suicide, but it truly is a health problem. You know, it's the 10th leading cause of death in the U.S., and what you see on TV every day with homicide is actually number 16. So nationally, we lose more people to suicide than what you see on TV every day. And in the world of students, ages 10 to 24, it's the second leading cause of loss of life. Number 1 is accidental, and number 3 is homicide. So also in that demographic, we lose more people to suicide than what we see on TV. So truly understanding that this is a real problem. And then in Pennsylvania, so that's nationally, then in Pennsylvania, it's the 11th cause of death. And then ages 10 to 34, it's again the second cause of death. So again, Pennsylvania kind of mirrors as far as that age group, 10 to 34. And then from a local perspective, Lehigh County, and we're always a year or two behind, so that's why I've noted the years. But in 2020, we lost 49 people to suicide. In Northampton County, in 2019, we lost 40 people to suicide. And also to put that in perspective from a county perspective, a Lehigh Valley perspective, Monroe County, we lost 30. So that's about 120 people. That's 10 per month. In this small, I would call smaller community in the Lehigh Valley. That's a lot of people to lose. So as far as Pennsylvania is concerned, we rank 37 among the 50 states as far as suicide. We're actually going in the wrong direction. You know, obviously I can tell you the pandemic hasn't helped a whole lot, but we are absolutely going in the wrong direction. We have a lot of people trying to reverse that direction, and we're continuing to work on it. For what we don't know, for the people that we lose to suicide, there's actually 25 attempts. So people are visiting the hospital that have attempted to take their life. That's some of the data that you don't know about. There's 25 attempts. And the other thing too is some people call it the ripple effect, but we lose, for every time we lose somebody to suicide, it affects 125 people. And you might think that that's not a whole lot, but I can tell you I lost my son 7 years ago to suicide, and it touched the community in such a way that we had people that we didn't even know come up to us and apologize for the loss. It touches so many people, and it hits two very big emotions. It hits anger and guilt, because people say, well, I didn't see any signs. I didn't see it. It didn't, you know, I didn't see anything that would tell me he would come to that decision. And that's the guilt of why I didn't do anything to help him. So, and I can tell you on the bottom, it's the age-old adage, but it's what a lot of us live by. One loss is too many. So, I'm going to do this there. Okay. So that's the dark side of it. It's a very difficult topic. I can tell you that most of the people we lose to suicide have a treatable mental health issue. Okay, it's a matter of them wanting to get help. It's a matter of us supporting their needs to get help. But there's also some other things in their life that may be affecting them that cause them to go into crisis to potentially look at taking their life. It could be life stressors. It could be losing a job. It could be a loss of somebody in their life that was very close to them. It could be, like I said, it could be a relationship issue. It could be a career issue, a job issue. Life's general stressors added to a mental health issue can create a real problem for people. But the message that I really would like everybody to take out of here is, although this is a very dark topic and a difficult topic, it's there's help. There's hope. There's hope. Suicide is absolutely preventable. Some people say, if they're going to do it, they're going to do it. Well, that's a myth. We can help people. We can help each other. We just have to actually do what the last bullet says, is actually be able to strike a real conversation. And for us that may not be struggling, it's a difficult conversation. You know, you first and foremost want to share your struggles with people. There's some people up here on this panel that have shared their struggles, and those sharing of those struggles kind of help people to understand that they're not alone. Because people that struggle from mental health, we want them to know that they're not alone. There are other people that are struggling. There's help available that you can get. And the one message that if you take nothing away from my presentation, it's that if you know somebody that's struggling, that's having a difficult time, that's close to you, that you know, and you see changes in them, and those changes last for 2 weeks or longer, all I'm asking you to do is walk up to them and say, hey, listen, I've noticed a change in you. Is everything okay? And I'm not saying that they're in crisis or they're looking at taking their life. It's just starting a conversation to open up the dialogue to let them know that you're thinking about them and that you're concerned about them. If they are, and be prepared. If you ask them that question, just sit there and listen to the answer. Most people who are in crisis, all they want you to do is listen to them, validate their feelings, and just listen to them. Don't judge them, don't put your opinions on them, but let's encourage them, or with them, or on their behalf, get some help. The last bullet there says, if you're at all concerned about whether they may hurt themselves, ask them. Ask them directly, have you considered taking your life? Very hard question, I understand, but one of the things that will do is that will take the barrier down if they're already thinking about it, because I can assure you, you asking them is not planting the seed. If you ask them, you've taken the barrier down, so now it kind of has opened that up if they are thinking about it. So we can prevent this. We just kind of have to work together and have a conversation. And a lot of people ask about resources. Now, one of the things that part of the presentation here is to talk about specific counseling opportunities here at DeSales, so I won't go into that. But from a national perspective, we have the Lifeline, 1-800-273-8255. And if you're struggling or you know somebody's struggling, that's what the Lifeline's there for. But if you know somebody's struggling, pick up the phone and call, because they'll give you advice. And the way that works is it'll look at your area code and it'll land you to the closest call center to this area. If you don't want to talk to somebody on the phone, there's a text line, 741-741. I can tell you these two numbers are in my phone. I've called them already. There's also available locally. So Lehigh County, Northampton County, and Monroe County all have crisis lines that you have local people manning those lines, and I can tell you those people are nothing short of amazing. They'll reach back out to you to make sure you're okay if you reach out to them. NAMI, which is the National Alliance of Mental Illness for Lehigh Valley, they have peer support groups. There's a phone number there for that. And then from just a web perspective, a lot of people like to read on the internet. AFSP.org, the American Association of Suicidology, and I do have the websites linked here, but they're kind of off color here, and the Jed Foundation. But they're all available resources. Those are all from a community perspective. this is not beyond the whole private counseling, psychotherapy, psychiatrists reaching out and trying to get some help in that regard. So with that in mind, I'll turn this back over to Colleen.
Thank you, Jim, for that important information and getting our conversation here today started. I know one thing that definitely struck me was the numbers that you shared. And I just ask everyone, if those that are here with us today in the room and those of you watching virtually, if we could just take a moment just to pause and just reflect on those lives that we have lost. Thank you very much for that. And again, just get that conversation started. And to continue our conversation here today, I'd like to now welcome Karen Peterson and Mark Kenny to share some information on how we got started here.
Thank you, and again, I would like to welcome you here today. So how we got started. Several years ago, I attended an Out of Darkness walk at another campus, and as a mental health professional, I went for that reason, but I also went because I recognized the impact to friends and family that Jim talked about, that it is that cascade effect. I was amazed at the stories that I heard, and I recognized that there were things that we could do and that we could just be there to support people. And so what I wanted to do was I wanted to bring that to the DeSales campus. I want this on our campus. So I approached the Mu Omicron chapter here at DeSales, and one of their platforms is service. And so they got on board, and we did that. But I walk because suicide affects us all. It's not just people that you think might be depressed. It's lots of people, and it affects those people that we may least expect it from. It affects different people, and we wear honor beads in order to show who we support and why we are walking. And you can see the different people that can be affected and the different ways that we can be affected. So 3 years ago, I brought the idea, as I said, to the Mu Omicron chapter, and collaboration is also one of the platforms that we use for Mu Omicron. And so we collaborated with several other local chapters, and that was one of the most important things that we did, I think, was to be able to do that. So in 19, 3 years ago, almost 4. Our first year, we raised over $15,000, and we were excited about that. And although it was a little chilly that day, you can notice by the jackets we're wearing, okay, we met our goal, and we had many sponsors that year, and we were excited about what we did. The next year, we joined with the other local universities and chapters, and we joined with Cedar Crest College, Moravian, Northampton. So we had lots of different people involved, Muhlenberg. Our planning team is an amazing team. We have people from Mu Omicron chapter, from here in DeSales. The student nursing organization here at this campus was very actively involved in that, and we have a representative every year from the Student Nurses Association to be on our team and our planning team to bring that to us. We also had Mark Kenny from the very beginning, who I'll introduce in just a moment, from the very beginning, who took that to his heart and continued the process from others. Cedar Crest College, as I said, Moravian, Muhlenberg, and Northampton. And of course, we couldn't have done it without Jim Presto from the American Foundation Suicide Prevention. When we reached out to him, because what did I know about making this event happen? They stayed alongside us, and there's lots of people who were there to help us in the process. So in 2021, we walked live and streamed virtually with participants from as far away as California and Florida. So we were really excited about that event. In 2020, although we were not able to have our real live walk, we were able to do it virtually. So even though everything locked down like 2 weeks before we were scheduled for our walk, we were able to do it virtually and we achieved our goal. But we are excited in 2021 to be able to be live and virtual. These are just some of the pictures of that walk. Okay, we have lots of participants, okay? In 2021, we raised over $48,000. So in a year when there was a lot of crisis going on, we were so excited to be able to meet our goal and more. 407 people registered. We had 27 teams, 6 colleges and universities from around the area. So we really expanded and we're excited for that. So we hope to again walk on April 2nd in 2022, and because of the numbers of people that we hope to get there, we are planning to move to the Lehigh Valley Parkway, so we're hoping that that's where we're going to be this year. We're working on that. And if you want more information, if you go to afsp.org, you can find the information, and we'll be up soon, I hope, for the link to our particular Out of Darkness walk. So I'd like to turn it now over to Dr. Mark Kenny from Chestnut Hill College, because as I mentioned, collaboration was one of the key features of why this worked. And we couldn't do it with all of the other universities and colleges that joined us to do that.
Thank you, Karen. First of all, I'm representing all of the entities, but I first have to say that I think the real reason why all of these entities have come together is because my experience with this planning committee is that they're very welcoming and very collaborative. So it is that their spirit that has radiated out into Lehigh Valley and has drawn in across disciplines and student organizations and student leadership organizations to reach the point where we are in 2022 for the walk happening in April. So our program is a clinical and counseling psychology program. And so one of the reasons Chestnut Hill College got involved is that our college is focused on social justice and advocacy work. And in the mental health field, we're also charged with advocacy work and moving beyond the tertiary and getting involved at the community level and the prevention level. So this was a wonderful opportunity for our students in program to be able to meet that goal. And so it also is a wonderful opportunity for our program to, as we are here on DeSales campus, to integrate with the healthcare departments in terms of reaching that goal that's out there in the profession of integrative behavioral health. So the idea that all of us, healthcare workers, mental health workers, are working together on an issue. And in addition, now we have students along the way with us working on this issue, and we have undergraduate students working with us. So this has been a wonderful experience for all of our members, because it is that idea that empowers all of us, no matter where we are in our professional journey and our professional work. And with the wonderful assistance of the American Foundation for Suicide Prevention to help guide us in that way. So we look forward for more to join us in our events for this upcoming year. So thank you.
Thank you, Karen and Mark, for sharing about that collaboration and teamwork. It's really great to hear and to see and to be part of, too. Now I'd like to introduce and welcome Kristen to come to share how she's gotten involved in our program.
Good afternoon, folks. As Colleen and my team has mentioned, my name is Kristen Eichholtz. I'm the Executive Director of Career Development here at DeSales, and have been a very proud member of what I call my second family here at DeSales, working with them on the Out of Darkness walk. So how did I come to get involved? Well, 3 years ago, I lost my sister. So it was June 11th, 2018, when I got the phone call at work here at DeSales that my sister had passed. My mom had called to let me know. Within seconds, my staff, we closed up the office. They drove me to where I needed to go, met my dad, and off we went to meet my mom. It is one of the most heart-wrenching days of my life. I hope to never have a day like that again. And as Jim mentioned, in addition to living on the memory of those that we've lost, it's also taking care of ourselves as the survivors of those who we've lost. And it could be a parent, it could be a spouse, it could be a sibling, it could be your best friend, it could be a colleague. And no matter who, that ripple effect is there, and it impacts us in many ways. And the thing is, too, that I always like to share is that it's not always as evident. Sometimes people are really good hiders of things. And my sister was 35 when she passed. She was a successful lawyer in Manhattan. She had just bought a house. She was 6 months in her house. She was also a fashionista, and she went into Manhattan and she would dress the public, and she would make sure they looked their finest for photo shoots, for work, you name it. And we knew that growing up, I knew she had moments. She had some rough days. She was someone that also suffered with an eating disorder. But she also had really good times and really didn't show signs of wanting to take her life. I was with her the day before she passed away. It was actually, my dad was in town because we were celebrating Father's Day early. And she was visibly upset about something, but was still able to carry on and have a real enjoyable day, and was able to just engage in conversation and laughter. And she bought me a doormat, because I just bought a house too, and that was her housewarming gift to me. And we drove past my new house that I didn't get a chance to show her physically, but I share this because you don't always see the signs too. And sometimes people are good at keeping it internalized and hiding it. And I just say, be someone that listens and that is attuned to anything subtle that's out of character. Maybe it is a few extra tears that maybe is not normal for them. And asking them, is everything okay? What do you need? Can I provide you with a resource? And then also, for those of you that are in attendance here, that are on Zoom, that are in person, if you are someone that has lost someone to suicide, I share my story because I want you to know that I'm here for you too, as a survivor and as a resource. And you don't have to be afraid to come to me and share your story or ask for help because you're afraid of how that's going to impact me. It's going to impact me for the rest of my life. And I'm going to have my good days, I'm going to have my bad days. But if I can be there and be that level of support, I want to. And the team here that's on this panel was just perfect timing, because Carrie passed away in June 2018, and it was only a few short months after that Karen started this organization. And it was just the perfect opportunity for me to give back, to live forth my sister's legacy and name and the wonderful person that she was. And I think sometimes people give people that have lost their lives to suicide a bad rap. How could they do that? How could they be so hurtful? How can they, not consider? You don't know. You don't know what's going through their minds at that time. I don't blame my sister. I don't know what was going through her mind at that time. I'll never know. And it's just being kind to yourself as survivors and being just attuned to what's going on around you. And I'm just so thankful I've found this other family here at DeSales. I will continue for as long as I am alive to give back to this organization and support the students here at the university, my colleagues, faculty, alumni, whoever wants to connect. And just know you're not alone. As Jim said, there is hope. There's hope in numbers and the support we give each other. So once again, if you're someone that you want to talk to as a survivor, or even someone that has had ideations or thoughts, don't hesitate to reach out to me. I am more than happy and willing to always listen. So thank you.
Thank you, Kristen, for that vulnerability and for sharing your story and your experiences. I'd like to now introduce and welcome Erin Fackenthal from our Counseling Center to share.
Hi all, thank you all for being here today. Thank you to all of our panelists thus far. Thank you, Kristen, for sharing your story. I'm always in awe when you share a little bit about your family and how this has affected you. I think it gives that personal touch to why we do the work that we do. And again, my name's Erin. I'm here with the DeSales Wellness and Counseling Center, and really just here to provide some resources for you today to share a little bit more about the services offered here on campus. DeSales mission, the motto we go by is committed, compassionate, caring. We are committed to our students' success, providing services that promote emotional and mental well-being. We are compassionate. We meet students where they're at, in a non-judgmental and supportive way. And we like to think we're caring. We're a dedicated team here that creates a space for students to openly discuss any kind of problems that they're currently experiencing or have experienced, to know that they've got a team around them that really cares for them. What I like about our center, we are all highly trained, qualified professionals who work with the students to be able to kind of walk them through whatever is on their top priority list in terms of mental health and well-being. What's really great is these services are free. In the community, that might not be the case here, but as a DeSales student, you are included in that care that is covered under your student service fees. Usually we'll get back to students within 24 to 48 hours. So this is a really fast turnaround, especially if you are in a crisis or you feel like someone else is in a crisis as well. Definitely make sure that we know that as we can get to helping you in a timely manner. These services are available for undergrad and graduate students for their duration of the academic year. And it's a pretty easy format. You'll just fill out an online consultation request, which we'll go over in a little bit. But wanting you guys to know, the main portion of this is that sessions are confidential and secure. So anything that you usually say in session stays in session. And we firmly believe in that, just because we want everyone to feel safe in what they're sharing. So counseling overall is a collaborative kind of confidential process in which students can work towards a lot of different things. And counselors are, again, there just to provide that safe environment to make sure that students feel cared for, feel empowered. We see students for a variety of reasons. So not only the topics that we're discussing here today, such as suicidal ideation and self-harm, but really the whole gambit of mental health concerns. So here's a few: anxiety, depression, homesickness, eating concerns, stress management, all of which can be a part of suicidal ideation, but also can kind of be their own separate issues as well. Some benefits of counseling. This often helps people see their thoughts from a different perspective. I always say it's kind of like a bird's eye lens. You get to step out of your reality for a moment just to see, things a little bit more clearly. Sometimes when you're emotional, it's hard to be able to step out of things and see them clearly. And hopefully, this is a space for you to evaluate those thoughts, to take that step back, to take that perspective. And hopefully find helpful ways of coping kind of with some of your mental health concerns. We also run groups. This is a great way to kind of meet with other students to discuss common themes and also really feel not alone in those experiences. A big thing with suicide prevention is making sure that you don't feel like you're a burden to others. And so that's something that we often discuss in counseling, as well as you're not a burden. These are typical experiences that a lot of students face. And so let's talk about how these are impacting you, and let's come up with goals and strategies as to how to keep you well. We're going to go over this a little bit more in further detail, so I'm going to keep this up here just for a little bit, but I know a primary thing we did want to discuss here today is what you want to do if you're concerned for yourself, mental health wise, and especially with if you're having any thoughts of suicide. For those online, feel free to take a picture of this slide. It is pretty comprehensive, but the key things I want you to take away from this presentation are: reach out. this has been the consistent message with some of our other panelists as well, but talk to a parent, a family member, a friend, a coworker, a colleague. People are there for you. They want to be there for you. You're not alone in that overwhelming feeling when you can share with someone else. And usually there is at least one other person that you feel like you can turn to discuss these things. Sounds corny, but things are temporary. What you're feeling right now might feel a 10 out of 10. Does it feel a 10 out of 10 tomorrow? A week from today? A month from today? Yes, what you're feeling right now is valid. And how can we get it from a 10 out of 10 to a 7 out of 10, a 5 out of 10, a 3 out of 10? Most importantly, if you can't do either of those other things, make an appointment to speak to a counselor. We're here for students, whether it be at our university, you can see a counselor, out in the community, any of the suicide prevention hotlines. I've had students who have called the hotlines. I've had students who've texted the hotlines. 9 times out of 10, I hear a positive experience. A lot of the times it's someone who's there for me in the middle of the night. I didn't know who else to call. They were a warm, supportive voice who was there for me. They kind of talked me down. And so it's nice hearing those stories because it's a real life validation that those services are utilized and that they work. Same thing, feel free to take a screenshot of this. I know it's a little text heavy, but if you're concerned for someone else, kind of like Jim said, show interest, be supportive. If you don't know what to say, that's okay. Listen quietly, offer comfort. Be direct, ask them if they're having any kind of suicidal thoughts. Listen non-judgmentally. The important piece is you don't have to fix the issue for them. There are professionals out there, and so offering our resources or pointing them in the right direction or just being an open ear. But really, you can always encourage the student to seek support. Here at DeSales, you can mention this to an RA. You can always call campus police. You can fill out our request form and let us know that you're concerned for someone. This happens probably more frequently than you would think. We are trained to handle these situations, and our number one concern is keeping our students safe. So we do everything that we can to ensure that that happens. Know that it's not your sole responsibility and it's not on your shoulders. And kind of like Kristen said, look after yourself. Take care of yourself, do things for you. This can be a little frightening. It can be a little bit intimidating. And know that at DeSales here, we have a whole support team around them. So our offices are open typically from 9 a.m. to 8 p.m. Eastern Standard, Monday through Thursday. Friday, we're here 9 to 4. You can fill out that quick counseling request form. Right now, we are fully on Zoom. So you'll just want to set up through the request form. If you ever happen to see us, feel free to let us know anything as well. However, this is typically the fastest and easiest way to reach us. And I just wanted to list some other helpful resources outside of our own services. So here's campus police's number. Just like you have the number in your phone for the suicide hotline, you should probably have campus police's number in there as well. They're always, there to provide support for our students. If you feel like you're in imminent danger, someone else is in imminent danger, call 911, go to the nearest emergency room. Here again is the National Suicide Prevention Lifeline, the crisis text line. I also wanted to include the Trevor Project, which is for LGBTQ plus specific individuals that talks about suicide prevention as well. Same with the Veterans Crisis Line. And then also I wanted to, as the last bullet point, include some long-term counseling outside of the university resources for anyone who might be in the audience or who might be watching, who might not be a student, who might be faculty, staff, alumni. You can go on Psychology Today and find counselors in your area as well. And feel free to check us out on social media. Here is our Instagram, Twitter, Facebook. We do post mental health resources. So even if you just want to dip your toes in the water, see a little bit more about what our services have to offer, for, get some mental health tips and tricks, feel free to check us out on any of these platforms. Thank you.
Thank you, Erin, for all those valuable resources. I'd like to open it now to a question and answer, both to those that are here in person as well as online. I think I have Kristen helping me monitor the chat box. None at the moment. Any questions here in our room? All right. So just a few questions that I'll ask to help get things started and our conversation started. So how does one become involved with the Out of the Darkness Walk at DeSales? If anyone on the panel would like to address that.
Probably for me.
Thank you, Karen.
So we will be starting to plan our walk in the next upcoming months. And so you will be able to log into afsp.org and look for Out of Darkness Walks. And then we will show up as a walk for April 2nd, and you'll be able to find us there. And then you can register from that site. If you're on campus and want to be on the planning committee, okay, it's very easy to do that. You can contact either Colleen or Mary or Kristen, any of the folks here from the university, and they'll be able to direct you so that we can get on the planning committee. The Student Nurses Association do have a representative, and I don't know who the representative is this year, but we will have a representative from the Student Nurses Association. So if you go there, you can make sure that you connect with them as well. And even if you're not someone who wants to walk, you can either donate money, you can be on the committee, you can join us for that day to help. There's lots of ways you can help, even if that's not really what you want to do or you can't be there that day. Okay, so there's lots of ways. One of the things that Jim mentioned that I think is important is that it's not just about raising the money that day, although we're pretty excited about the amount we raised. But it's not just about that. It's about the support for other people. And just as Kristen gave you her story, and I'm so glad that she was able to share that and she came on board, and I know that it wasn't easy that first year to share her story. I spoke with several people this last year before our walk who had lost someone in their family, and they were able to talk to me about that, and more important, it was something that they could do and feel good about doing in honor of the person that they lost. And so to me, that was probably even a bigger part of what we did, was just being there for those people.
Thank you. What if I'm recognizing, or I think I'm recognizing someone that's suffering with depression? What can I do? Who can I call for help? Erin, thank you.
This kind of goes back to the one slide that was a little bit text heavy that I shared. You can take a screenshot of at any point. We are here to provide services. Again, nothing is on your shoulders that it feels like you have to take care of that person. I hear this from students a lot. I have felt that myself in my own life too, right? Of like, I want to be a good person. I want to be there for my friend. Being there for your friend, you can refer them to services. So know that you're never alone. If you're concerned about someone, definitely let us know in the request form that you are concerned for someone else's safety. That way we can get to this request as soon as possible. And we will then kind of look into the situation. We will kind of take it from there. But again, just being supportive, being an active listener, and being there for a friend in that time of need does more justice than you could ever imagine.
What are some things that I should be watching to recognize for someone that I may be concerned about for depression or suicide?
Yeah, I like Jim's suggestion, right? Like if you see a difference in pattern, especially for a more extensive period of time, kind of 2+ weeks, reach out to that person. You know, if they are retracting from everyday activities in an abnormal way, no longer going to class or no longer enjoying the things that they used to enjoy, you know, if there's extreme fluctuations in mood, really any of those big changes, you'll definitely want to, you know, keep your eye out and just kind of check in, see how things are going on.
Did anyone else want to share? No? Okay. Okay,
Yeah,
Jim.
just also from a community perspective, you know, the lifelines were put up there. The one thing that I did not mention that if you know somebody who's in crisis and you feel they're in crisis, please do not leave them alone. Stay with them and until emergency comes or help comes, family members come, friends come. If you're absolutely concerned, dial 911 because we do not want to leave that person alone. As Aaron said, crisis will pass, right? So it's just a matter of putting time between the person in crisis and just helping them through that, being that listening ear. But if you're at all concerned, if they've all told you that you've asked the question and they're considering hurting themselves, please have no issues in dialing 911. Make sure the family you get in touch with somebody in the family to make sure you sit with them. So I just wanted to add that.
Thank you. If I have a friend that's not a DeSales student and they've mentioned depression or suicide, who can I go to? Other than these hotlines that we talked about, I guess.
Well, you have the crisis lines, the lifelines. You also have the local crisis lines, and then you have the private care. Aaron mentioned psychology today, but just stay with them. If you're at all concerned about them, have a legitimate conversation or an open-ended conversation with them, and just a listening ear, so they feel that you're there to help them.
Thank you. I know we talked a little bit about the survivors of suicide. So what type of resources do we have for those individuals as well?
I'm glad you asked that question because I just wanted to respond to that. That one of the resources that I've used a lot to help people, in addition to talking and being there for them, is that the American Foundation for Suicide Prevention website has wonderful information to give to people, hand out to people, point people in that direction, and even for yourself in terms of learning more about what to do. And so I just wanted to make sure that you use that website because it's been very instrumental in finding information in any way that you want to.
I just wanted to add, if you're in pre-crisis and your employer may offer you an EAP, Employment Assistance Program, which could get you connected very quickly to somebody for at least maybe 5-6 sessions. So, and sometimes that's a far easier connect than searching for someone privately on your own. So I would certainly check your employment handbook to see if you have an EAP option. And this would be in a pre-crisis state. Or if you're noticing a loved one and you think they need assistance. And there's no harm in that, and that is confidential in the employment realm, and use those services and encourage your loved ones to use those services too.
So just to add to the services available or the what's available locally from a survivor perspective, I can tell you first and foremost, it's an interesting word, survivor, but it's kind of what we do, kind of what Kristen attested to, and what I can tell you that our lives have changed forever, and that there is a group within this community, a larger group than you think. You can see as the walk here has grown, as the community walk has grown with participants, is that more and more of us are touched by this tragedy. One of the areas of importance for the American Foundation for Suicide Prevention is survivor support. So as Karen said, if you go on to the AFSP.org, and there's a button there that says Get Help. It's got a couple options if you're struggling, to Karen's point, but one of the areas is if you lost someone. And I will tell you really quickly that there's a couple different options. One is the walk, and those walks, as Karen kind of talked about, provides an opportunity for survivors to come together with friends and families to share memories, good memories of their lost loved one. But it also allows you to come together to make friends, right? I never knew Kristen before this walk started, and I'm glad I know her. It's kind of, we share a poor thing, but we know we can lean on each other. So those walks are intended for that. We also have support groups that you can actually put in your zip code, and there's support groups around. I could tell you in the Lehigh Valley, we just went back to in-person. So there's an in-person support group as well as a virtual support group right now. And the other one is Healing Conversations. It's called Healing Conversations, but it gives you an opportunity to fill out a form. It gives you an opportunity to talk to somebody locally that maybe has lost a sibling, has lost a child, has lost a parent, and we team you up with somebody, whether you want to talk on the phone, meet in person, talk virtually, but you can talk to somebody who understands that pain that you're going through and how that has changed your life, and you can kind of share all that, because they can tell you that unless you've endured this tragedy, you don't quite understand it, and that kind of put people together that understand it. And then the last thing we do is called the International Survivors of Suicide Loss Day. It's always the Saturday before Thanksgiving. We are setting that up right now in the Lehigh Valley, but it's an opportunity for survivors to come together one more time in a fashion where they can make friends and share some memories and actually get some help. So those are a couple of the programs. But again, if you go on afsp.org, click Get Help, you'll see I've lost someone to there, and you can select that.
Thank you. Thank you, everyone. Before we close this morning, I'd just like to have the panel just kind of share one more time about the mission and this walk and why it's so important to them. I'll let you guys think for a moment. Oh, we do have a question. Perfect. Sorry. Pause.
Question we have is, what do you recommend for someone who seeks regular counseling, but it is not available either because there is a shortage of providers or their insurance will not cover it?
Karen, do you want to address that?
The one thing I want to say is that you can get coverage even if you do not have insurance covered. There are base service units in every county in the country where you can get services, and so you're able to go there. And certainly if it's an emergency, then you need to be going to facilities that take emergencies, such as your emergency room or a facility that is a crisis facility, and those are available so that you can get help immediately and also to get on the list. And so it can be difficult because we do have a problem with the numbers of providers, but if you express it's urgent, then most facilities will get you in some place, shape or form.
Mark?
This is a serious issue in the mental health profession. There is a high need, and there's not enough professionals out there at the moment. So I think what Karen is saying is, if you have immediate need, then seek those emergency services. You can also start probably in some cases maybe start at least at your primary care provider. They may have some ability to connect you to individuals in the community through their healthcare system or their own personal contacts, professional contacts, to help you generate some names. There are counselors that do, psychologists and licensed clinical social workers that do provide services on a sliding fee scale. So you can approach those individuals. And actually in our ethical code, there are opportunities for pro bono. So there may be some counselors out there that are providing those services. So seek out as many agencies and organizations as possible, and also know that there are virtual options. So telehealth is still in effect for mental health counseling at the moment. So you may be able to reach through one of the websites. I believe there's 2 large ones that are providing telehealth. Helping Hands, I think, is one, or the name's eluding me. But there are online services now, if you can manage that in the immediate until you can get to see someone locally face to face. So try all those services. And if in doubt, then I would reach out to at least the professional organizations, such as the Pennsylvania Association of Social Workers or the Pennsylvania Counseling Association, and seek some guidance from them in terms of recommendations to get connected to a licensed mental health professional. Oh, and the Pennsylvania Psychological Association.
Thank you. Are there any other questions from online? Okay. All right, well, before we do close this morning, I would just like to talk once more about the walk and why it's so important to you all. I'll get us started and let you guys have a chance to think about your answer. So I got involved not only because of my presence here at DeSales University and Omicron, but it was something that was really important to me. As a nurse, I've working in the emergency department for many years. I've obviously cared for several patients that have dealt with depression and suicidal thoughts and so forth. But prior to my nursing career, I actually was working in emergency medicine as well. And I have seen several colleagues suffer with depression and anxiety related to their job role and have lost colleagues as a result of all the job stressors. And so this walk and this mission really, the message of no one's alone really hit home to me, and that message is what my colleagues needed to hear and to feel, which is why I've joined the mission and the walk and why it's so important to me. Jim, do you mind sharing?
No. The very first time that I attended a walk was in 2014, was a few months after we lost Josh. And it's actually, to this day, it's probably one of the most toughest, heart-wrenching experiences that I've ever had to do, but it was, at the end of the day, it was good because I was surrounded by probably 30 or 40 family members and friends. We all got t-shirts, we all wore the same thing, and we all talked. And we all, like I said earlier, we all kind of talked about Josh and shared memories and just kind of just got together. I did actually meet a few people from the local chapter of AFSP. From that point on, I got involved with with AFSP, and actually I still walk. It's still very difficult for me. It's still a very emotional day. Even coming to the DeSales walk is a very difficult time. But I know that it's helping others, and it's helping me. And my wife actually had to talk me into coming to the one in 2014, and I was glad she did because I wouldn't miss it at all because just of the chance. In 2014, there was 500 walkers. When the last time we could be in person, a few years ago, there was up over 2,000 people that attended that walk. So on one hand, the good news is coming between the campus walks, the community walks, that the word's getting out that there are people in this community. We tell people that struggle with mental illness that you're not alone, but we also want people that have lost loved ones to suicide, that they're also not alone. So it's great that more people are getting the word, but it's also very tragic that we are losing more and more people to this cause. So that's how I got involved.
Thank you, Jim. Mark, would you like to share a few words?
I walk for my mother-in-law, and so it's been very helpful. And that's just recent. My mother-in-law passed in 1995, so it's just recently I've become involved in the walk, and I walk for her, and I walk for the fundraising for the research, because that's where we're going to find the solution, is in the research, and getting others to do that, to contribute to the foundation's work in trying to find a solution, I think is also helpful for survivors to know that there's action being taken.
Oh, Jim, go ahead.
The one thing that I did want to add that I usually do is that for everybody who's attended the walk and the great job that DeSales and the rest of the schools did this past spring with $48,000, just so you understand, 50% of that money stays in the community. And that goes against suicide prevention, local research grants, as well as the national grants, with the rest of the 50%. But I want you to know that 50% of that money stays here locally, so that we can do, collectively, we can help save lives.
Thank you. That was important to share. Karen, do you mind sharing a few thoughts?
As I mentioned, as a mental health professional, I have seen the impact that suicide has on other people. And so if you know anything about nurses, you know that we like to fix things, and there really is no fixing, but there is a way that we can make a difference. And so the Out of Darkness walk was a way that I could feel like I was doing something. But they have taught me so much more than that. This team has been incredible over the last 3.5 years to work together. So I've learned that it's not just the doing. It is about the being with people. And I couldn't express any better how important it is to be with others. It's important to me, and it's a great team that we have that works together that makes this happen. And it's a great thing to do.
Thank you. Kristen, do you mind sharing?
Sure. So, as I mentioned, I started participating in the walk after the passing of my sister Carrie in 2018. Jim was actually the first person I met that had lost someone so close to him, and it helped me to know that there was someone else in the room that knew what I was feeling and my family was going through. So I do walk for my sister. I also walk for my own therapy. I walk to help my parents because it's a ongoing battle for them. I was able to bring my mom to her first walk this past year, and it was gut-wrenching for her, but she appreciated it. And like Jim said, she knew she wasn't alone, that there were other people that were experiencing it. And to go to Mark's point of research, I don't want anyone else to feel like this. I don't. It's awful. It is absolutely awful. And if we can continue to work together to raise money, to raise support, to educate, to be there for folks and let folks know they're not alone, we can maybe reduce those numbers and really not have the people left behind to wonder why and have to question. So this walk is so important to me personally, but also just for our community and our other campus communities to educate and continue their research.
Thank you. Mary, would you like to share a few thoughts?
Sure. So I first got involved in the walk through my role here at DeSales. Like Colleen, as a nurse, I mean, it's been hammered home again and again through many patient encounters with just how much of an issue this is. On a personal note, I think I was 7 or 8 when a very close family friend committed suicide. And she wasn't actually my aunt, but we called her Aunt. And I just remember that being a very formative experience for me because as a child, I was trying to process it. And to this day, I still think back to that person who was so vibrant. When you were talking about, your sister, it made me think of my aunt. And I was like, the type of person that every Christmas, every birthday just came in, just brought so much light and joy. And it's still, to this day, I still think about it. And it's so hard to wrap your mind around that. So I really appreciated what was brought up about the ripple effect. And again, this wasn't even someone who, was an actual relative, but still, this was a family friend who was, part of my life. And, it's a loss that's still felt. I mean, this is how many years later that, it still hurts. It still hurts. So I really appreciate that this campus is trying to, bring more light to this issue. Even if it's one person that we reach, one person that year who, through the walk somehow gets help, that's enough. So I just want to thank everyone on this panel because everyone has been so amazing to work with as well.
Thank you, Mary. And you do bring up a very good point that, it's the people that you least expect sometimes. I'm tearing up as I think about my colleague that I lost. And he was full of life. As soon as he entered the room, you knew he was there. And it still hurts. So, yeah. Erin, do you mind sharing?
I heard something this year that really resonated with me, and I don't know if any of you have heard this too, but people have shared the sentiment for 9/11 and saying that the 12th was such a peaceful day in New York. And oddly enough, through so much trauma, there was so much bonding. And to me, that's what the walk is, that even though you yourself have been affected or people close to you have been affected, that there's this sense of community, this eerie calmness almost of the community coming together to be one, to support one another, to lean on one another. And when I heard that in regards to 9/11, I definitely thought about the walk.
It's very beautifully said. Thank you. Before we depart, I just would like to ask Karen one more time just to remind us about our walk and our efforts for 2022. Once she gets her mic on.
Yes, that's the hardest part. I wanted to thank you all again for being here. Because as Erin said, if we can make the difference for one more person, we've made a difference. And also, Jim talked about the astounding statistics that are not getting much better. So the more we can do, the better we can make it, and there's lots to do. But you also heard about how being together is so important, and I would just like to thank this team again and the planning committee, because it's an amazing team, and you can see we get all emotional about talking about the issues, but just about all the things that we can make a difference, and that hope is really important. So we are planning to have another walk April 2nd, 2022. That's the day that we're hoping to do it, and we're hoping to be at the Lehigh Valley Parkway because we're hoping to have so many people that we don't fit on this campus anymore. And so we're looking forward to that. If, again, you'll go to afsp.org website and go to the Out of Darkness Walks, you'll be able to find our walk when we get it up registered in the next couple months. Thank you so much for coming today.
And I just want to thank our panel here again for sharing their stories and their hope to all of our survivors out there, and also all those that are going through tough times right now. The message today of don't giving up and being a supportive person to others is such the DeSales motto. You know, we are a DeSales family here to be who you are and be that well. And I think today, through your stories and your support for others, don't give up out there. Today's program will be available on the DeSales University YouTube channel, so it can be shared. If you know somebody that you would like to send this to, we will have this available. Again, we thank all of you at home that have joined us. Thank you to several of you who shared your stories as well on the chat box with others. Again, our prayers are with all again. Thank you, and we all hope you all have a great day.